Okay, welcome everyone. I'm Anna Verrill, the moderator for the session, Senior GIS Analyst with CGIA. Thank you for joining the session, Exposure to Diesel Particulate Matter and COVID-19 Mortality in the Continental US. Presentation is being given by Martine Machu. She is a PhD student at the Center for Geospatial Analytics at North Carolina State University, whose research interest is spatial and temporal modeling of air pollutants and particulate matter, environmentally persistent free radicals. She is a Fulbright scholar from Haiti. Before coming to the US, she worked as a project manager at the United Nations Environment Program. So welcome Martine, and welcome everybody to the session. As a reminder, you can enter the chat by clicking on the button, join chat, and throughout the presentation, feel free to put any questions or comments you have in that chat, and we'll get to those at the end. And we are recording this presentation, and they will be made available on the YouTube channel following the conference. So with that, I'll hand it over to you, Martine.
Thank you so much. I'm very excited to talk about exposure to diesel particulate matter and COVID-19 mortality in the continental United States. So it's a topic I've been working on since last year, and two professors, Dr. Gray and Dr. Richmond Bryant, they are helping me with this topic. So why is it important to study the association between diesel particulate matter and COVID-19? So through this presentation, we will see how both COVID-19 and diesel particulate matter could affect human health, especially the respiratory system, and how they could be spatially related. As you already know, COVID-19 is a respiratory disease. Since the report of the first cases in January last year, more than 28 million cases have been identified and almost 500,000 people have died in the US. Those are numbers from last Monday. Although COVID-19 is a new disease, a few months after the first cases, based on different studies quickly conducted, the Center for Disease Control was able to state that adults of any age with certain underlying medical condition, they are at higher risk for severe outcomes from COVID-19, severe outcomes such as hospitalization and death. So among these underlying conditions, there are asthma, cancer, pulmonary fibrosis, heart disease. Also, smoking and obesity have been listed as comorbidities that can increase risk of severe illness from COVID-19. On the other hand, a recent study conducted in November 2020 by Fair Health in collaboration with Johns Hopkins University, determined some risk factor for COVID-19 mortality. So of patients died with COVID-19, so those numbers reflect only patients who were infected and actually died from COVID-19. So they found that about 83% of them have at least one comorbidity against 17 that didn't have any underlying condition. Among those comorbidities, lung cancer had the higher risk factor among patients under 70 years old. So the same study estimated the odds ratio of dying from COVID-19, and in this same group age, patients with lung cancer were nearly 7 times more likely to die than patients who didn't have any lung cancer problem, and 2 times for patients with COVID-19 and heart disease against compare with patients who didn't have any heart failure. So what happened when we add diesel particulate matter to the scenario? So diesel particulate matter, the more general term is particulate matter, PM. So PM is just a mixture of solid particles and liquid droplets found in the air. They can be of different sizes based on the diameter. The finer they are, the deeper they can go into the respiratory tract. The particles that form diesel particulate matter may include hundreds of different chemicals. They include soot particles made up mainly of carbon, ash, metallic particles. They also include sulfate and silicates. So diesel particulate matter comes from diesel exhaust emitted by diesel engines. Although most private car nowadays, they are gasoline engines, a lot of other vehicles related to occupational activities, traveling, even kids going to school, expose us to diesel particulate matter. The main sources are heavy duty, mainly big trucks and school buses. And the second category includes agriculture and construction activities. And we also have a lot other sources. So all the solid particles contained in diesel exhaust, they are DPM, and they are very harmful for human health. When inhaled, they go to our respiratory system, and after a long-term exposure, some people, in general, people living near freeway, they are really likely to develop cardiovascular disease, respiratory disease, lung cancer, or to die prematurely. Studies have also shown that communities with low incomes, also minority communities, they are the most exposed in the US. So COVID-19 also enters our body through inhalation. And if you remember the underlying conditions that could affect COVID-19 outcomes presented just before. So 3 of them are also listed in the DPM health effect. Therefore, based on the hypothesis that there might be any relationship between COVID-19 and diesel particulate matter, we assess if living near these DPM sources make people more likely to die if they get infected with COVID-19. So to analyze the potential spatial correlation between DPM and COVID-19, we use different data sets. First, we use the Johns Hopkins COVID-19 dataset. And this map just represents the cumulative deaths related to COVID-19 until October 2020. And until this date, the distribution of COVID-19 deaths varied from 0 until about 1,000. 1,000 in some counties, and then the darker areas, they are the counties with more deaths. Then we also use the National Air Toxics Assessment dataset. It's a dataset with different data about air pollutant. So we map the distribution of the annual average DPM concentration measured in microgram per cubic meter. If you look at the map, DPM concentration has a really wide range in the US from 0.005 until about 1 microgram per cubic meter. And that means some counties or states are really more exposed than others. And here again, the darker an area is, and the higher is the DPM concentration. Before any statistical regression analysis, we compare visually our 2 main data sets. And we can see that in the Southwest, there is a higher DPM concentration and also the greater number of deaths from COVID-19. And it's kind of the same for the Northeast, that means the New York area. And our last set of data includes confounding variables. from the American Community Survey and also from the health ranking. And we consider socioeconomic data, some environmental, behavioral variables, and also some demographic data. And from a total of about 25 variables, so we selected 7 confounders: Black race, homelessness, income inequality, housing costs, smoking, poor health. Poor health means quality of life based on chronic diseases in a population. And we also included people who don't have any health insurance. All those variables plus DPM concentration have been used to perform spatial and statistical analysis that can be really divided into 3 steps. So we're gonna see those 3 steps. So first, we fit an ordinary least square regression using COVID-19 as the dependent variable. And the coefficient, I mean, those numbers, they are really the coefficient for each of the variables. And the coefficient for DPM concentration really shows that for every 1 microgram per cubic meter increase in DPM, there is an increase in COVID-19 death of 7 people out of 100,000. And all the variables, they were statistically significant. However, considering the assumptions that if the residuals are spatially autocorrelated, this indicates that the model is misspecified. So we also evaluated for spatial autocorrelation in the residuals. And from the residual map, you can see some clustering indicating possible spatial dependence. So that means a value observed in one county could depend on the value observed in the neighboring counties. So because of that, we further did some spatial dependent tests that revealed that there is effectively some spatial autocorrelation, which suggested for further analysis based on spatial models. So, and then because of that, we fit 2 global spatial models. We fit a spatial lag model and also a spatial error model using the same equation. So the spatial relationship has been defined based on neighborness. That means we consider that a county could be affected by the other counties with which it shares borders. And in terms of model fit, so the spatial lag and the spatial error perform kind of equally with a R-square of about 39%. So, but it was important to evaluate both since the 2 models, they are kind of fundamentally different. So spatial lag tells that mortality rate in a county affects mortality rate in its neighboring counties. And spatial error, it's more about the error term. So it is indicative of omitted spatially correlated variables or latent variables that are not present in the model, but might affect the inference. So, and you can also see that the coefficients are really different from spatial lag to spatial error. 4 for spatial lag, 5 for spatial error for DPM concentration, 43 against AD for unanswered, 158 against 13 for poor health, etc. So we then think that it will be great to further investigate. So, and because of that, I mean, because we think that there could have some spatial dependence across the United States. So we fit a local model using geographically weighted regression. So overall, this the geographically weighted regression improve the model has been improved, as that can be translated by the R square that we got, that is about 45%. And at a local level, the model performance were very, very variable. So the southwest and also the northeast, this area, they perform much better with a R square between 60 and 80%. Also, coefficients of all variables, they vary by a lot, which also indicates some spatial variation. So DPM concentration, for example, varies from minus 34 to 41. And the high association between COVID-19 death and DPM concentration is also, you can also see that in the southwest, but mainly in the northeast region. I also would like to highlight the association between smoking and COVID-19 death. So it was kind of surprising that there is a negative association between smoking and COVID-19, since we saw before that lung cancer is really has a very high risk factor. But we also check the literature, and really we found that many different studies found that there is a negative association between smoking and COVID-19 death. So finally, we also map the coefficient of all the other variables to see how it varies across the United States. And as you can see, for not only for DPM, also for income inequality, for poor health, Black, and housing costs, there is a positive association specifically in the Northeast region. So what can we really conclude from this study? So first, our first conclusion is that we see that an increase in long-term exposure to diesel particulate matter increases the mortality rate of COVID-19, especially in the Southwest, the Los Angeles area, and also in the Northeast, the New York region. Our second conclusion is that although DPM is statistically significant, but we also see that that other variables, they have a much better, a much larger association with COVID-19 death. Third, there is a special effect in the association between DPM and COVID-19. And our fourth conclusion is that the geographically weighted regression model performs much better in evaluating the association between DPM concentration and COVID-19 than the other models that we test. And our last conclusion is that there are really some uncertainties in the models that really indicate that there are need to further investigate other potential variables that we didn't consider in the analysis, but that could affect COVID-19 mortality. So that's all. Thank you so much. So if you have any question, you can type it in the chat. Thank you.
Great, thank you, Martine. I have been monitoring the chat and nothing has come through thus far in terms of questions. So if anybody listening does want to ask a question, you actually have to join the chat by clicking join chat. There's a button, and then you can get in here and type your message. I like the image you have on the last slide.
Thank you.
It was a very insightful presentation for something that's affecting all of us throughout the world.
Yeah.
So still no questions coming through.
Okay.
I'll leave it up to you how long you want to stay on.
Yeah, I think I can stay just a few minutes.
Okay. Somebody's asking for a way to contact you. So Kathy Wolf, I will email Martine your name, and both of you could find each other's contact information in the attendee listing that was sent out, I believe yesterday. There's a full list of everybody who was attending the conference in there with their emails. So you can connect that way.
Mm-hmm. Yeah, you can email me. No problem for that.
I'll make sure I connect you two after this.
Mm-hmm. Thank you.
Okay, I'm not seeing any more questions come through. So up next, there is a break at 3:30,
Mm-hmm.
and sessions begin again at 4, just for everybody's knowledge. And Martine, are you okay with ending the session now?
Yes, sure. Thank you so
Excellent.
much.
Thank you for your time today.